Hello, everybody. This is Gary. Today is February 24th, 2022. It's 5:48 p.m. Eastern United States in Rochester, New York. This is my Coping with Schizophrenia blog entry for today. Today, I just wanted to do another update on my pain and my use of Cymbalta to treat my physical pain. I have been having over the past couple of severe nerve pain, severe muscle pain, and severe joint pain, um, as well as arthritis pain. Um, I've been taking Cymbalta now for almost 3 weeks. We started at 60 milligrams daily, and we're now up to 120 milligrams daily. Cymbalta, by the way, is an antidepressant. In some situations, can be used for physical pain. And in my case, we're talking about muscular skeletal pain. We're talking joint pain, muscle pain, and nerve pain. Um, it's possible that I have fibromyalgia, although I have not been officially diagnosed with anything other than arthritis and bone spurs in my lower back and in my left knee. But that doesn't explain all the physical pain that I'm in. So fibromyalgia is a possibility. And I think that's why we're using Cymbalta to treat my pain. Um, so far, the pain seems to be a lot less severe than it was, say, 3 or 4 weeks ago. Since I started on Cymbalta, right now I still have some physical pain, especially my lower back, the upper right side of my back, um, my lower left leg, my left shoulder. I have some old injuries that are also causing me physical pain. I have a detached clavicle in my left shoulder. I have arthritis in my left hip. And as I said before, I have bone spurs in my lower spine, as well as arthritis in my lower spine, arthritis in my upper spine, bone spurs in my left knee. I'm seeing an orthopedic specialist on March 2nd to look into those bone spurs and the arthritis. Um, I'm having a lot less severe pain in my right knee after I fell down and twisted it on the bus. I had gone to urgent care to make sure there were no broken bones in my right knee, and there was none. There was no fractures. There was no joint dislocation, and the pain seems to be a lot less severe than it had been over the past previous weeks. Um, I hope that holds to be true in the future. Um, I'm not limping around favoring my left leg over my right leg like I was just a few days ago. So in some ways, the Cymbalta has definitely reduced my pain, or at least it seems to have. Um, I'm also taking other medications for pain, including Tylenol, Aleve, Flexeril, and Neurontin. Um, but the pain was persistent even with all those other medications, so we added Cymbalta to the regimen. My psychiatrist is not the one prescribing the Cymbalta. My primary care doctor is the one prescribing the Cymbalta because even though it's an antidepressant, that's not the main reason I'm taking it. I'm not taking it so much for depression as I am for the physical pain. Um, it's only been about 2.5, almost 3 weeks since I've been on the Cymbalta. It's too early to tell what the full benefit will be for another couple of weeks. My psychiatrist had told me, first of all, don't expect complete pain remission. That's not realistic. And the other thing is that it can take up to 5 or 6 weeks before Cymbalta gets into its full effect in pain relief when you're taking it for physical pain relief. Now, if it happens to help my depression and anxiety at the same time, well, that's just an added extra benefit because Cymbalta is an antidepressant. Um, I'm not a doctor. I forget which class of antidepressants it is. Um, and I'm not telling anybody they should take or should not take Cymbalta. I'm not a doctor. I'm simply going over my own personal experience with the drug so far. Um, I have had side effects alternating constipation and diarrhea, um, little brain fog, um, some confusion, um, just a little hazy in my mental thinking, forgetful, that kind of thing. Um, but for the most part, I'm coping well, I think, and I'm willing to continue to take the Cymbalta to see what the full benefit may or may not be, because I don't know yet. It's too early to tell. Um, I forget the generic name for Cymbalta, um, but like I said, it's too early to tell what the full benefit will be. And as far as my schizophrenia and schizoaffective is concerned, my symptoms aren't that bad today. My anxiety levels are pretty high. I am experiencing some physical pain. Um, my depression isn't all that severe today. My paranoia is not all that severe today. Um, I was depressed for the past week or two and I didn't clean my apartment. I managed to get around to cleaning it today. My paranoia is pretty much under control. My auditory hallucinations are pretty minimal. They're at baseline. And that's all for now.